COVID-19 is one of the worst pandemics to hit mankind since the Black Plague. At the time of our research, more than 5,041,173 deaths have been reported, with 249,264,747 documented cases. While we have administered 7,216,018,363 vaccines, one of the most pressing issues of our time happens to be the characteristics, cause, factors and origins of this virus that led to this pandemic of global proportions. According to World Health Organization, COVID-19 is a disease caused by SARS-CoV-2 classification of viruses. While most people are expected to experience manageable respiratory illnesses, the disease can aggravate individuals with underlying medical conditions such as cardiovascular disease, diabetes, chronic respiratory disease, or cancer are more likely to develop serious illness. While death can occur for individuals of any age group, aging individuals have been identified to be the most vulnerable to fatal outcomes. The virus spreads from an individual's mouth or nose, encapsulated in small liquid particles when they interact or partake in activities. Often, COVID-19 spreads when a person coughs or sneezes. Even touch has been cited as being one of the ways the virus spreads. Essentially transmitted as respiratory droplets, transmission is rapid as the disease is highly contagious. If infected, COVID-19 takes about 5 to 6 days, in some cases, even up to 14 days until symptoms are demonstrably visible. Common symptoms are fever, dry cough, fatigue, nasal congestion, sore throat, diarrhea, chills, dizziness and, in severe cases, shortness of breath, loss of appetite, loss of awareness leading to confusion, persistent pressure in the chest as well as high fever. According to current understanding, about 80% of patients get better without much medical intervention. However, 15% of patients require extensive medical treatment and up to 5% may need life-critical medical intervention. These individuals may also be susceptible to organ failure and develop severe inflammation. Prevention is the best medication against COVID-19 and vaccination is highly recommended universally. However, social distancing, general hygienic discipline along with regular testing can go a long way in prevention. Rapid tests are currently widely available. Typically, two forms of vaccines are currently available: the mRNA vaccines, such as Pfizer-BioNTech Comirnaty and Moderna, and the inactivated virus vaccines such as the Sinovac, Covaxin, and others. Other popular vaccines are also the AstraZeneca vaccine, that is a chimpanzee adenovirus. The primary difference between vaccines is that mRNA vaccines use RNA messengers which teach our cells to produce proteins that trigger an immune system response leading to production of antibodies against viral infection. Inactive virus vaccines use unreactive COVID-19 particles that are injected into the body to stimulate immune system response. This vaccine resembles in method found in common vaccines such as those for polio or rabies. The most important social response, based on advisements issued by all institutions and governments, has been vaccination. Typically, 2 shots of vaccines are needed, with anywhere between 21 to 40 days between each administration. Effects can last anywhere between 6 months to 12 months, where annual single booster shots will be necessary to maintain immune system's readiness in combating COVID-19. A vaccinated individual's age, prior health conditions as well as the type of vaccine determines vaccine effectiveness period. Several countries are now working towards learning to live with COVID-19 as an endemic, with a high percentage of the population vaccinated. At the time of this report, there were 4 major COVID-19 variants that have been documented by the scientific community. Namely, they are B.1.1.7, B.1.351, P.1, B.1.617.2 or more popularly known as the Alpha, Beta, Gamma, and Delta variants respectively. It is difficult to generally point to the geographic origin of each of these mutations specifically. However, often the UK, South Africa, Brazil, and India are cited where first mutated COVID-19 cases may have emerged. The most generally accepted scientific consensus is that the virus has originated from the country of China, the city of Wuhan, with the first reported case being documented on December 31, 2019 as a cluster of cases of pneumonia. This report was sent by Wuhan Municipal Health Commission to the World Health Organization. By January 12, 2020, China publicly shared the genetic sequence of COVID-19. By January 13, 2020, the first COVID-19 case was reported outside China, in Thailand, which is located in Southeast Asia. By January 20, 2020, an expert team from World Health Organization visits Wuhan. On March 11, 2020, the World Health Organization declared a pandemic. By then, more than 18 countries had COVID-19 cases. While it is believed that bats and pangolins were the most obvious progenitors for SARS-CoV-2, contemporary view is that since mammals such as mink and cats are also susceptible to SARS-CoV-2, additional mammalian species may have possibly been a potential reservoir for COVID-19. While the exact location of this outbreak is difficult to deduce, Wuhan is often cited as the most widely acknowledged origin for COVID-19 by the global scientific community. Based on currently available data, earliest samples received from patients from Wuhan's Huanan market had identical virus genomes. In the build-up to the year 2021, political inclinations have led to various political factions pointing to a wide array of geographic locations. However, the factuality team can confirm that the current scientific consensus is that Wuhan, in China, was the city where the virus was first reported in clusters, though diagnosed as a case of pneumonia. It will not be accurate to assert, suggest, or insist another location as the origin of this outbreak. The factuality team did a review of the World Health Organization document. At the time of this report, the document was updated on April 6, 2021. Primarily, based on expert opinion, the current origin investigation of the virus has been based on 4 hypothetical theories postulated by scientists. 1. Direct zoonotic transmission. 2. Introduction by an intermediary before zoonotic transmission. 3. Introduction through cold food chain. 4. Introduction through lab incident. While the hypotheses shared are formal and officially acknowledged, based on current review, investigations are pointing towards introduction by an intermediary before zoonotic transmission theory as being very likely. The next hypothesis of direct zoonotic transmission is considered to be likely, while theories of introduction through cold food chain and introduction through lab incident are considered possible and extremely unlikely respectively. In the diagram, we reclassify the current consensus on the virus origins. 1. Introduction by an intermediary before zoonotic transmission. 2. Direct zoonotic transmission. 3. Introduction through cold food chain. 4. Introduction through lab incident. Let us discuss the findings based on factual conclusions. For introduction by an intermediary before zoonotic transmission, this theory postulates that transmission is initially done to an animal by an animal reservoir. From that host, eventual transmission to human beings may have happened. This is generally the most likely scenario, as similar viruses in pangolins have previously been documented. Due to the presence of practices such as high-density farming, animal reservoirs have become an increasingly likely scenario. It is worth mentioning that factors such as genetic distance and data from farmed animal reservoirs has not been available to scientists. For direct zoonotic transmission, this theory postulates a direct transmission of the virus to the human host from the animal reservoir without the presence of an intermediary. This is another likely hypothesis due to the SARS epidemic experienced in East Asia in 2003, where some species of bats with SARS-CoV were found to be able to transmit this virus to human beings. Antibodies from the virus's proteins have also been found in human beings, suggesting a possibility of spread without an animal reservoir. However, while consumption of bats and pangolins and other exotic animals are common in countries in East and Southeast Asia, current scientific consensus is that no direct evidence is present to link such consumption habits to the SARS epidemic. However, they do suggest that an unidentified animal reservoir may have been possible in this hypothesis. For introduction through cold food chain, this hypothesis has often been postulated by scientists and political factions located in China. It is not the most likely scenario that led to the COVID-19 pandemic. It postulates the contamination of cold meat leading to secondary outbreaks in different locations. Scientists have indeed found cases of such outbreaks in China, specifically Qingdao, where viruses were isolated from food packages. However, general scientific consensus is that there is a very low probability of this being a cause of the COVID-19 outbreak. There is also a logical case that a contagious virus being contained in another country prior to China may not have been feasible to postulate. There is also no visible transmission route prior to China. Finally, the introduction through lab incident, as the Wuhan Institute of Virology moved to a new location next the Huanan market on the 2nd of December 2019, it is postulated that there may have been an accident due to poor laboratory management practices in China, as it is a developing country. It has been reported that the closest strain, known as the COVID-19, to the reported viral strain in the laboratory, matched at 96.2%. After investigation, the World Health Organization has said that there have been no records of SARS-CoV-2 in the laboratory. Having assessed staff records for safety standards as well as medical records prior to December 2019, no anomalies were found. There are no records, at least those submitted to the World Health Organization's investigation team, to suggest that a possible lab incident may have been the reason for the pandemic. Safety standards for virology laboratories are tightly regulated and are benchmarked. For the record, the Wuhan Institute of Virology is classified BSL 3 or 4, which suggests a high level of biosafety standard. The economic impact of the pandemic has left profound reverberations throughout the world. World Bank has suggested that the global economy may have shrunk by 3 to 4%, while unemployment levels, in the United States alone, reached 14.8% in April 2020 as per Congressional Research Service. To put some figures in perspective, the global economy may have lost anywhere between $3 to $4 trillion in value, with millions out of jobs. As economists are working towards putting figures together, the health as well as economic costs imposed by the pandemic has been consequential to us as a species, no matter where you live. These are the facts collated by the Factuality team for your consideration. We have collected these facts in an impartial manner, to ensure that facts prevail and information reaches us, as it is, so that we can make up our own minds. As per our maxim, independence of thought is paramount. We take our leave with this report and hope that you have found this informative. Please do subscribe and like the video if you have found it useful. Until the next report, farewell.